There are a number of EMS agencies in the state that get by year to year on bake sales. I mean, they literally don't have the budget to keep diesel in the ambulance.
That's Wayne Denny, the chief of Idaho's Bureau of EMS and Preparedness. He laid it out for us last summer. Idaho's emergency medical services agencies, especially in smaller counties, are struggling to stay staffed, updated, or, as you heard, even keep fuel in the tank. But a bill which just cleared the Senate could change that. Here's what EMS faces in Idaho. By law, the state does not designate EMS as an essential service, like police and fire. Therefore, the state is not required to fund it. Therefore, many EMS agencies, of which there are 44, one in each county, well, they face a never-ending battle, a string of bake sales, if you will. How many lemon bars, by the way, do you think you have to sell to cover the cost of a $200,000 ambulance? That's just to get the updated equipment. What about the people you expect to drive that ambulance and possibly save your life? A recent report by the Office of Performance Evaluations found about 7 out of 10 of those who drive the ambulances and show up when you call them, they're volunteers. But this emergency medical services issue didn't just emerge recently. It can be traced back nearly 2 decades. In 2006, the state legislature decided it would be a good idea to look into how EMS services were handled in Idaho, how it was governed and funded, that kind of stuff. They created the EMS Code Task Force, which spawned 4 years of trying to address it at the State House, but nothing came out of it. Then in 2010, the Office of Performance Evaluation released a study where they found gaps and sometimes duplications in EMS coverage because of a lack of clarity about who's responsible for what. They found such services are quilted together across the state with a patchwork of agencies and resources, threaded together by outdated state codes. They also found a need to have a governing body, which would have the authority and the funding to develop, maintain, and consistently deliver quality emergency medical services. They made it clear then how policymakers can establish an effective system that would place patient care as the top priority. Basically, someone has to be in charge. 11 years later, J-Law created another task force, the Idaho EMS Sustainability Task Force, to figure out how to fix it. They hadn't done anything up to that point. But that brings us to 2024, 3 years after that, and Senate Bill 1416. It would move EMS out from the Department of Health and Welfare and put it under the Office of Emergency Management, thus establishing emergency medical services as essential and therefore making it more consistent. A better system, according to the experts like those in Lincoln County who told us last August, better than their system, where starting pay for an EMT is less than $11 an hour. Their equipment is more than a decade old, and if they have to go out on if they have to go out on 2 ambulance calls in one day, more than 2, well, they have to call in a volunteer who then has to have the ability to leave her job at a moment's notice. Did I mention these agencies aren't required to respond to every call for help? Okay, so today there was a call to solve that problem. However, during debate, there were several members of the Senate who were worried more about what it would cost, like Senator Chris Trakel, when he learned patients would still have to pay for a ride in an ambulance.
Call something an essential service, but then still require the taxpayer to pay for it out of their own pocket when they utilize said service. We don't do that with fire. We don't do that with law enforcement. So I have a hard time increasing the size of government and more spending with no cost reduction to the individual that requires the services.
Everybody complains all the time about the federal debt and Washington and the president and all that kind of stuff. We're at something like $34 trillion right now. Well, this bill, which I said has kind of baked into the cake a lot of federal money over several years, is going to further inflate that federal debt balloon.
So to be clear, this bill would only offset the cost of staff and equipment to bring it up to date and make it more centralized and consistent. As for what it would cost, well, nothing for fiscal year 2025. But this move to OES would be a transitional one, not an immediate one. Making this a law in Idaho would be the first step in a 5-year process. The Office of Emergency Management will then set the budget for September for fiscal year 2026, and that's expected to be about $2.2 million. Then based on what is needed locally, more funds could be allocated, and they could even call on federal money. They could use that if they needed to. The other side of this argument came from Senators Carl Bierke and Jeff Schrader, who said this bill isn't about growing government. It's about an essential service, as defined by Idaho's Department of Health and Welfare, a function that is required to maintain the health and safety of a community, and not something based on your location.
What is your level of expectation in the state of Idaho? Is your level of expectation that you call 911 and you don't believe that someone's going to be there knocking on the door within 4 minutes? Or are you okay with an hour, hour and a half? A body recovery versus somebody who's actually been saved.
This has to do with how you allocate and how you create a functional system that saves Idahoans' lives, no matter where they are, and not have that ability to have your life saved be a function of the property value and the levy rate in the county in which those services have to be bought.
Senate Bill 1416 now headed over to the House after passing the Senate 29-9.